Documentaries are about the people that you meet and the stories you can tell. Stories of tragedy, laughter, hope and desperation, across faraway lands or right here in your own backyard. This podcast brings these stories to you, the listener, so that you can experience the adventures of documentary filmmaking in audio form while embarking on daily adventures of your own. Welcome to Barefoot Media's Stories Within Stories podcast with your host, Simon Holland. Today on the show, we are talking to Paul Forden, CEO of South Metro Health, a collection of hospitals with some 11,000 staff. Paul is an outstanding leader who navigated healthcare services through the global pandemic. Emerging from the crisis, Paul has been forward-thinking and looking at the remarkable innovations in medical science to improve the service delivery to the hundreds of thousands of patients that pass through his doors. Welcome to the show, Paul Forden.
Thanks. Glad to be here.
Would you be able to let the listeners know a little bit about what you do?
So I've got the privilege of being what they call the chief executive of the South Metropolitan Health Service. South Metropolitan Health Service looks after the public health for all of those, really ranging from Fremantle across Murdoch all the way down south to the Mandurah, Pinjarra areas. I've got 5 hospitals within that and some community services.
And that's a lot of people working in those hospitals.
So it's somewhere around 11,000, I think. So a lot of people. It's about 1 in every 150 West Australians who work. So when you say it that way, it sounds a lot, but I'm surrounded by great people, so it just makes it easier.
And what about turnover of people that come through hospitals? I mean, I've been to your hospital 4 or 5 times myself in the last few years, just for various injuries, sports and things like that. So, but how many people come through and you're seeing people really at a critical time of need?
Sure. So I think our total patient interactions each year are about 750,000. So yeah, there's a lot of people. And it ranges from those who might just be coming in for 6-monthly checkups, which are routine, maybe cancer follow-up just for screening, to those who maybe need a heart transplant, lung transplant. They've been in a major fire. They've had a horrific motorcycle accident and they kind of acquired a brain injury. So it goes from kind of one end of the spectrum all the way through to some of the most complicated surgery you'll ever wish to see.
When I was in there, they said that emergency room that you've got there at Fiona Stanley is one of the biggest in the Southern Hemisphere. Yeah. How do you go about running one of those?
Well, thankfully for everyone listening, I don't run it, so I'm responsible for it. But again, we've got great people in there who it's probably, I think it's either the first or second busiest in Australia, probably one of the biggest in the Southern Hemisphere. Australia tends to have the biggest in the Southern. So I pass through it quite frequently, the one in Fiona Stanley we're referring to. I've got other ones in Rockingham. We've got one in Peel Hospital. So I try to spend my time in thirds. So I spend about a third of my time with the business of the hospital, do you know what I mean? Like running executive meetings, attending board meetings, all of that formality. I spend about a third of it wherever I can out and about. So whether that's talking to people in university sector, in other health agencies, in other connected industries, it might be tech or it might be something pharmaceutical or something. And then as much as I can, I try and spend a third just walking around the hospitals, just spending time with staff and patients. And that's where I really get the best info, the best intel.
And what sort of knowledge and intel are you looking for? What's the big picture for you that you're trying to gather and decisions that you make off that info?
Gosh, that's a hard one to answer. What I'm looking to do is I get lots of reports with charts and stats, etc. But I try to triangulate it. And what I mean by that is, if somebody says yesterday was a really busy day, I like to hear people say to me, yesterday, Paul, it was like the busiest I've ever known it. Then that validates what I'm hearing. Maybe that's not a great example, but as much as I can, I triangulate what I'm hearing. But also a lot of the time, I'll pick up things that aren't in the stats. So did I know that so-and-so lost her husband last week unexpectedly and she's only a young lady? Or maybe that there's an issue with something that's not working. I haven't heard about it. It's a really important thing to those people. So as much as I can, I try to hear about that. So maybe I can make an impact.
So you've got a personal touch to that, to the data as well.
I try to. I never have enough hours in the day to spend as long as I'd like. I'd like to spend all of my working day just walking around, but then you actually can't get the time to do the things that you need to act on.
Yeah.
So it tends to balance off in thirds. It's never a third every day. And I think I always say the best thing about my job is every day is different. And the worst thing about my job is every day is different.
And what's it like from being the focal point for so many people and so many disciplines? What's it like being that one person? You get up in the morning, you go to bed the same as the rest of us, but what does that feel like?
It doesn't feel like that at all. I don't feel I'm the focal point. Mostly we try to devolve decision making. So almost all the decisions are taken by really great clinicians, and they're the right people to take decisions every day. Does this patient need this drug or this drug? Do they get discharged today or in a week's time? Do we perform this operation or do we allow time to see whether it can make a difference? So I don't get involved in any of those decisions. And quite rightly, I'm not a clinician. I'm there for more of the making sure the organization has the right level of funding, to make sure we've got a good way of communicating with our staff, trying to make sure our strategy is going in the right direction, making sure we're making the right investments. And if there is really something that's so important that nobody else can take a decision on, I have delegated authorities, I can take those decisions.
Have you ever had a chance where you needed to do that, or is that something that you think you don't put a saddle on a Mustang, let's give it to the doctors?
Oh, no. You can't renege your responsibility either. So sometimes you have to take decisions. Probably one of the most difficult times for me was back when I worked in the UK. You can tell from my accent I'm not Australian. So back in the UK, we had a dreadful December with patients requiring ICU care. It was across the whole country.
We get to 27 degrees over there, did it?
No, it was more to do with bird flu.
Oh.
And so our ICU was not able to cope with demand, and nobody's was. And we were having to decide who goes to ICU and who doesn't.
Oh.
And I had to provide the decision-making support based on clinical advice to the clinicians, because it was wholly inappropriate to leave them playing God. That's not fair to them. Now, whilst I wasn't saying this patient needs to go because of ABC, I was able to try to take some of the pressure off them when you get to that level of decision-making.
And you just got to make the best decision based off facts. Are you thinking as a human? Because that's a real moral dilemma there. That's almost like that one where they say if you're in a moving train and you've got to hit the old guy or one of those things, and that's a massive decision like that.
It's very rare to ever get to that situation. During COVID, a number of us worried we were going to get there. We didn't. But sometimes there is no perfect solution in a life problem. And thankfully it's very rare, but when it happens, I think my role is then to provide the relevant support to those people who are faced with such a difficult dilemma.
Exactly. And with so many people coming through your industry, you've got those massive amounts of data. What's the future of medicine? How does it improve? You hear from doctors all the time, it's at breaking point, it's stressful, everyone's run off their feet. What's the future of medicine and how are you going to take it from here?
So I'm minded that the only constant in healthcare is change. And the stethoscope was invented in 1836. And that's probably the only instrument we still use in the same format. So everything else has changed. When Keir Hardie started the National Health Service in the UK back in 1948, his pitch to Parliament was, if we invest now, we'll only have to invest for 3 years and then we'll have solved healthcare. And they only spent about 2% of the gross domestic product on healthcare at the time. So we now spend almost 10% in the developed world. Excuse me. If you want to know how bad it can get, France is spending 13% of gross domestic product on health, so almost 50% more. And the USA is up to 16%. So I don't think there'll ever be a day when healthcare is not an issue, because the population is getting older. The number of things we can do has increased dramatically. Patients who 20, 30 years ago would go to a very, very, very specialist center may now go to a general practitioner. So the things we can do are incredible. And I think also the public's expectations has increased dramatically. So maybe in the past, people would get out to a doctor and say, if you say that's all you can do, that's all you can do. Now you've got Dr. Google and everybody's looking at what else could I try? And it gets very, very difficult. I had a very, very sad occasion where I had to intervene with a family a number of years ago, not in Australia. And the poor lady, she was in her 50s. She had terminal cancer. There's no way around it. And she had a matter of maybe 8 weeks to live. But she was so sick she had to be in hospital for that period. And her husband wanted to sell his business and take her to the USA to try and save her life. And he would go to any length to try to save her life. And I had to say to him, the best thing you can do is spend every waking moment with her and be there for her. But I think there is an expectation everybody can be saved, almost getting that way. And that puts enormous pressure on the whole service.
What's your philosophy on death and mortality? Is it a matter of fact? Because for me, it does seem that that's as natural as birth. It's a given all the way through. I've always been aware that at some point it's die, so the process is the fun. But what's your fundamental belief on that?
Look, we've never found a cure for death. I don't think we'll ever find one. And maybe we never should, because the population of the world only has a small planet to live on. So, yeah, if the population grows to increasing levels, which they're talking about, how does it feed itself? How does it provide the energy? How does it sustain itself? And does that create a life that's maybe not so valuable? Who knows? So my philosophy has always been, like most people who are well, and touch wood, I'm well, yes, I accept death's there, inevitable. One time in my life, I got very close to it. And all of a sudden it became a very different philosophy, which is, what can you do to save me? I don't want to die. I'm too young. So I think it depends on your situation and the circumstance you face.
With that near-death experience, did you have a revelation what it feels like to be that close and in good hands, or what?
Yeah, it happened very, very rapidly to me. And I remember passing in and out of consciousness, and I hadn't been diagnosed. I actually had an internal bleed. And I remember them giving me fentanyl and saying, lie down. And I was saying, no, I've got to sit up, because I just knew I was doing the right thing sitting up. I was actually clenching a bleed and fading in and out. But I knew I was in the right hands. And that was what kept me probably from screaming, was I knew they would get me and I knew they'd save me.
And that's such a weird thing to think. This is how it ends. This is the end of that chapter. But that you can have those one last people that can intervene and extend that. And for all those generations of humans that have ever come before that didn't have access to that medicine, or still don't, that we can have somebody that gives you that extension on that.
Yeah, we have, in one of my hospitals, we ran the WA heart and lung transplant service. And we actually had a gathering last year of those lung recipients who came back together. And I think there may be 100 transplant patients. And the beauty was they brought their families. And it wasn't only the wife that was with them when they had the transplant. It was their new children they'd had since the transplant, and their grandchildren who they'd had since the transplant. And to see that one life we saved, there may be 6 or 7 other new lives that wouldn't have been there. That was awesome.
Yeah, when you look around and you just sort of think, oh my goodness, we are so lucky in this country, in Australia, and we are known as the lucky country, but sometimes it doesn't really feel like that because of your own personal struggles. Do you get perspective when you've come from somewhere else, or when you travel the world and you see how other people go through medical facilities?
Yeah, look, we are super lucky over here. That's not to say it never goes wrong. It does go wrong. It only takes one in a million and you've got something going wrong. It's not hard. But mostly I think healthcare is done